Greetings. Today, we'll explore whether stem cell therapy can help repair heart muscle damage after a heart attack. A heart attack, or myocardial infarction, occurs when blood flow to a part of the heart is blocked, causing damage to the heart muscle. This damage can lead to reduced heart function, fatigue, and long-term cardiovascular complications. Many people are now exploring regenerative therapies and ask, does stem cell therapy help repair the heart muscle after a heart attack? If we haven't met already, I'm the digital avatar of Dr. Max McLeod, also known as the Nutrition Ninja Doc, founder of MyBodySymphony.com and the STEM Region/Age Reversal Technology Center, ARTC.Health. He is a problem solver with a focus on helping people overcome their health challenges and achieve their health, performance, and appearance goals. He is using this avatar to save time making videos that can be better spent helping people. My role as his avatar is to convey his knowledge and insights about health, healing, and regeneration. Please realize that I'm an avatar of a doctor, and none of what I convey should be considered medical advice. It is for educational and entertainment purposes only. Consult your trusted healthcare provider before making any significant changes to your health regimen. Doc Max also provides individual supervision, in person or virtual. Contact us at 941-806-5511 to learn more. Now let's get back to today's topic. Before that, I ask that you leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way to help get these health-related presentations out to more people. During a heart attack, heart muscle cells, cardiomyocytes, are deprived of oxygen. Unlike some other tissues, these cells have a very limited ability to regenerate naturally. As a result, the damaged areas are often replaced with scar tissue, which cannot contract like healthy heart muscle. Over time, this translates into reduced pumping capacity and efficiency, typically monitored by the ejection fraction. That is the percentage of blood pumped out of the left ventricle with each contraction. It should be between 50 to 70%, but heart damage can dramatically reduce that. Stem cell therapy, particularly using mesenchymal stem cells, MSCs, or cardiac progenitor cells, aims to support the repair of damaged heart tissue. It may help by reducing inflammation in the affected area, supporting the survival of the remaining heart muscle cells, encouraging the formation of new blood vessels, releasing growth factors that promote tissue repair. While stem cells do not immediately replace scarred tissue, they create an environment that supports natural regeneration and healing. Patients undergoing stem cell therapy after a heart attack may experience improved heart muscle function, including improved ejection fraction, increased blood flow to damaged areas, reduced risk of heart failure progression, better exercise tolerance, and quality of life. These improvements usually occur gradually and may require follow-up treatments. Stem cell therapy may be most effective for individuals with mild to moderate heart damage, recent heart attacks where some viable tissue remains, patients seeking additional support alongside standard cardiac care. Severe heart damage or advanced heart failure may still require surgical interventions or mechanical support devices. As with every organ that is not functioning properly, we take a comprehensive approach to support its ability to heal and regenerate. Our bodies have tremendous healing potential. However, we often need additional stimulation and support for it to fully recover. All healing is a function of our stem cells. As we age, we lose up to 99% of them, and the ones remaining simply don't work as well as when we were young. By infusing young stem cells from umbilical cords and exosomes, these young cells help to revive your existing stem cells. They even donate mitochondria to them to help them function better. As wonderful and amazing as stem cells are, they are not magic. They need all of the foundational nutrients plus some specialized ones like coenzyme Q10, NAD+, and glutathione to do their job. Most people are deficient in several nutrients and therefore need to upgrade their nutrition. Additionally, we help to reset and restore proper microcirculation using things like EWAT, exercise with oxygen therapy, HIIT training as appropriate, light therapy, vibration therapy, and specific peptides to optimize the body's healing and regeneration. With this kind of comprehensive approach, I've personally seen heart function as measured by ejection fraction go from as low as 13% and climb to 65% in less than a year with our program that includes IV stem cells and exosomes. Stem cell therapy is not a guaranteed cure for heart muscle damage. Nothing is. Outcomes vary depending on the severity of the injury, patient health, and treatment protocols. It is considered a complementary therapy alongside conventional cardiac care rather than a replacement. It is also important to point out that stem cells are not approved to help heart conditions due to the current politics and economics of modern medicine. Therefore, no claims can be made. They should be viewed as a potential adjunct to proper cardiac care. Stem cell therapy shows promise as a supportive approach for repairing heart muscle after a heart attack. By reducing inflammation, promoting tissue repair, and improving blood flow, it may enhance recovery and overall heart function for selected patients. Ongoing research continues to explore the most effective methods and long-term benefits. To learn more about whether stem cell therapy might help you, contact us. STEM Regan, Age Reversal Technology Center, 941-806-5511. Website ARTC Health.